on the MRI and complete resolution of a big disc which was present initially on the MRI. Can you give me any comment about this? Because the meta-analysis, when you read the literature, just restrict the patient's activity, prevent him from bending, prevent him from lifting heavy objects, and he should take few exercises. But I think the old way of the treatment will still work in some patients. And thank you very much.
Thank you. I think you're right. You can treat a lot of this patient conservative. Especially in Europe, but nobody is tolerate a bed rest of 3 until 4 weeks in the year 2011. You have extended studies, especially from the Scandinavian countries, including more than 30 up to 50,000 people. They show that you have much better results and a quicker return to week in case of operation than conservative. If the pain is caused by a sequestered herniated disc, we don't talk about protrusions. You have to decide. But when you think about an operation, you think about a patient. Picture is one thing, the MRI is one thing, and on the other hand, you have the patient. If I have persistent radicular pain syndrome about weeks, or 1 week, 2 weeks, 3 weeks, the patient is reporting about paresthesia and severe radicular pain, and I can treat this with an operation, I do this. Because it's the fastest way, and this is study-based and evidence-based medicine, to bring him back to work until 3 weeks. I cannot fix a young man in the middle of 30s with a sequestered herniated disc in the bed for a few weeks, because then he's losing his jobs and he's not able to pay for his house and for his family. He needs to come back very quick to work. And I don't talk about disc protrusion. If you have a black disc or a facet syndrome and so on, then you do conservative therapy, yes, as well. We will not like to fuse everybody into ours. This is not effective. First of all, the pain therapy is the most important thing. You do the facet blocks, the apparate and outward blocks. But if they have a sequestered herniated disc or significant spinal stenosis, and they do not responding to the interventional pain therapy procedures, then there is something to operate. You have to do this from the short-term analysis in 3 up to 4 weeks. This is the quickest way to bring them back. But not everybody is to operate. You're completely right.
Thank you.
It has been improved that the outcome of surgery is very good in the early period. But if you compare two patients, one treated conservative, one treated operative after years, then those with conservative treatment showed better outcome than the surgical. I quite agree with you, Dr. O'Day, and probably a lot of colleagues, they are doctors, treated conservative, and they do very well. Well, of course, you know very well, sometimes you have to operate as soon as possible. So it's a critical balance between unreasonable haste and unnecessary delay. And it's up to you to decide which way. Thank you.